J.R. Rutsky. I'm an orthopedic surgeon specializing in shoulder surgery and sports medicine at Washington Orthopedics and Sports Medicine.
After my first surgery, which was arthroscopic, I would play golf and I would feel it occasionally when I would chunk a ball. It just didn't feel right. When I would throw a baseball or anything, it didn't feel necessarily like instability, but it was just not, didn't feel right, and I knew there was something wrong. And ultimately, it dislocated after my first surgery when I was playing hockey. I got hit in front of the net, and it wasn't a hard hit at all, and it completely dislocated and it was out. I had to go to the hospital, and then I knew I needed to get a second surgery after that.
Dan came to us because his shoulder was profoundly unstable and interfering with his ability to participate in activities of daily living and sports participation. He had an excellent procedure performed elsewhere arthroscopically, but unfortunately in about 5 to 10% of cases, patients will have recurrent instability, and this was the case with Dan. We discussed his treatment options, looked at his physical exam, looked at his imaging studies, and in particular paid attention to both the findings of his MRI as well as his CT scan to quantify bone loss in the shoulder. And this is the most important consideration when looking at revision stabilization treatment. Revision shoulder stabilization in Dan's case requires a careful assessment of bone loss in what we call the articular arc, which is the total of bone loss from the glenoid or socket side of the shoulder blade and the ball or humeral head portion of the shoulder joint. Because when the ball dislocates out the front, there's going to be a divot or an impaction injury called a Hill-Sachs injury in the shoulder. We quantify this articular arc and then can make better recommendations for patients on their likelihood of having a successful arthroscopic or open revision procedure. In this case, we felt with Dan that the best thing to do was a French procedure called the Latarjet. This restores bone stock and has 3 separate mechanisms for conferring stability to the shoulder by cutting the coracoid, this piece of his own bone from the shoulder blade in the front, and rotating it and then securing it to the front of the socket. So we do this through a split in the subscapularis. That creates a sling effect from the inferior half of the subscapularis tendon. When the shoulder comes back into this abduction external rotation throwing position, he's going to have a restraint from this sling that helps to reduce the risk of the ball sliding out of the socket. The second mechanism is increasing the depth of the socket, because if I have now rotated this piece of bone into the front of the shoulder, it's going to make the socket wider, and a wider socket is going to be harder to dislocate. And finally, the third is by reinforcing the ligaments. We take this coracoacromial ligament attached to the coracoid that we're going to transfer and incorporate it into a repair of the capsule. So through these 3 mechanisms, by transferring this piece of his own bone with 2 simple screws, we're able to confer shoulder stability with a high rate of success.
Honestly, it's great. It's been about 1.5 years now. I just graduated from school. I went on a golf trip to Ireland, played a bunch of courses over there, didn't feel my shoulder one time. I've been surfing this summer, 2 of the most hard activities on your shoulder, golfing and surfing. And I still play hockey every day, so I'm very happy with where I'm at. I would say that they're fantastic and I highly recommend them. You just trust Dr. Rutsky from the second that you meet him. He was very confident in what he was going to do. He mentioned his procedure to the Latarjet, which I knew nothing about, and within minutes I knew that he knew everything about it, and I would trust this guy to do my shoulder 10 times out of 10.
Dan's surgery went quite well and he was a pleasure to take care of, but the reality is the surgery is only a small part of the process. We have a team approach where we work closely with physical therapists and then collaboratively with Dan as a patient to have fun in taking him through his recovery, through the rehabilitation protocol, and getting him back to the activities he loved, in specific golf and ice hockey.